P syndrome, Western differentiation, ankylosing spondylitis. AS is an inflammatory systemic disease with unknown pathogenesis. It mainly affects the spine and sacroiliac joints, but it can also affect other joints, tendons, and ligaments. Other areas, such as the eyes, lungs, bowel, and heart, can also be involved. Ankylosing means fusing together. Spondylitis indicates inflammation of the vertebrae. AS describes a condition by which some or all of the joints and bones of the spine fuse together. Entire fusing of the spine is unusual. Many people will only have partial fusion, sometimes limited to the pelvic bones. The association of AS with the histocompatibility antigen HLA-B27 is known, although the role of the latter in the pathogenesis of the disorder remains unclear. Inflammation occurs at the site where certain ligaments or tendons attach to bone, as in most of the forms of spondyloarthritis, which encompass psoriatic arthritis and RA. This is followed by some erosion of bone at the site of attachment. As the inflammation subsides, a healing process takes place and new bone develops. Movement becomes restricted where bone replaces the elastic tissue of ligaments or tendons. Repetition of this inflammatory process leads to further bone formation, and the individual bones that make up the backbone, the vertebrae, can fuse together. The sacroiliac joints are commonly affected first. The lower back, chest wall, and neck may also become involved at different times. Typical symptoms of AS include slow or gradual onset of back pain and stiffness over weeks or months rather than hours or days, early morning stiffness and pain, wearing off or reducing during the day with exercise, persistence for more than 3 months as opposed to coming on in short attacks, feeling better after exercise and feeling worse after rest, weight loss, especially in the early stages, fatigue, feeling feverish and experiencing night sweats, nocturnal pain. Special attention should be paid if the patient reports progressive joint stiffness, especially in the morning and bilateral, and signs of inflammation such as swelling and joint redness. Thank you for your attention.